Nobody knows what's going on. Nobody knows. Nobody has the faintest idea. The best guesses are lies. You may be sure of it.
Dr. Ed Caddye, thanks for joining me, brother.
Thanks for having me. It's great to do a podcast with somebody who's had so many great guests on before.
Yeah, thank you. I'm having a good time just connecting and learning and trying to share the things that I find to be valuable. And Amy, who I had on the podcast, Kartar, she did some studies on breath work and superventilation breath work, which is a pretty rare subject, but she thought it would be fun for me to be connected to you. And I started listening to you on some podcasts, and we think very similarly, and you seem to be a wealth of knowledge. So I just wanted to dive into who you are and share with the audience a little bit about some of your background and what you're currently working on, if you don't mind sharing a little bit of an overview.
Yeah, I suppose I have kind of these three pools I put my knowledge into, which is movement, which is a big passion of mine and was actually kind of prior to my interest in medicine. And then the other one is metabolism, which I got into deeply. I studied biochemistry for 4 years before going to medical school, which has always kind of been my foundational perspective on everything that I'm doing with clients from a clinical perspective and with health generally. And then the other one that's maybe a bit more prominent these days is mental health, and kind of merging all of these things. So the movement, the metabolism, and the mental health being the frame of which I kind of see clients through. And drawing from different specialties and not necessarily having one field, although I'm formally trained in biochemistry and medicine, as I said, and more recently psychiatry, but I'm also trained in this specialty that we call health optimization medicine, which was pioneered by somebody that's infinitely smarter than I am, with an IQ of 210, and he came up with all of these amazing clinical frameworks. So putting a lot of the complexity that we see in the health world these days in a framework that allows ideally clinicians to make sense of that stuff in order to help the patient or the client that's sitting in front of them with the science that is available to us now. And it's maybe even more available to everybody now with AI. And AI is amazing, but maybe AI is great if you know how to use it and how to prompt it and ask the right questions. So having these frameworks is fantastic, because it allows me to put all of my different interest into an actionable step for whoever comes to see me with whatever problem that they have.
Yeah, who was that mentor with the huge IQ? I'm just curious what his name is.
His name is Dr. Ted Achacoso, and he's not super well known, but if you find the podcast with him on, then you'll know why he has an IQ of 210.
Awesome. I would love to just listen to one of his after it's over. I'll make sure to look him up. But have you always been somewhat of a person who likes to learn continuously about a lot of range of things, where you're somewhat of a decentralized thinker or a generalist when it comes to approaching things and cross-cultural ways of learning? Because it seems like when I listen to you, it's rare to find a person who studies medicine that doesn't get somewhat pigeonholed down that specialization route. And I think that seems to be a major issue. I mean, it's beautiful to some degree if you're looking at trauma or something like that. We really master that. But when it comes to thinking about biology, it's very complex, as you know better than anyone. And it doesn't seem like many people cross-pollinate their thinking very much. And you go down to the biophysics and you study all of it. Have you always been that way?
It's a good question. I think I wasn't always that way, but I was at medical school, and having studied biochemistry, I always expected a lot of medicine to be applied biochemistry. And then I got into clinical medicine, and I just saw a lot of blind spots and almost a resistance of the medical establishment to want to understand those blind spots. And there's reasons for that. They're very stressed, and they have their algorithms that they follow to make sure that they're acting in a safe way. But I actually listened to, I was talking to my friend about this the other day. There was a podcast. It was one of the early Tim Ferriss podcast episodes and he was kind of this human guinea pig type guy and always has been, who interviewed Charles Poliquin. And because of my interest in movement and exercise, I kind of picked up on a few things that he said. And he was into kind of the functional medicine approach. And he made a point that in some cases, some of his athletes and clients would have an issue with digestion and gut health. And that it wasn't that they had too much stomach acid and they needed a proton pump inhibitor, like everybody's given in conventional medicine, but actually they didn't have enough stomach acid and they needed support with that part. And then this light bulb went on, which doesn't seem too crazy, that it's very independent for each individual, and we need to pay attention to biochemistry. And there may be this concept of balance that comes in, which is, are there any imbalances or deficiencies that we need to address? And that's one of actually the frameworks of health optimization medicine, that we detect and correct imbalances and deficiencies, because then we can balance the system as a network. So I think it was that original light bulb of, oh, okay, so maybe everybody doesn't need a drug for an excess or a deficiency, but maybe it depends on whether that person has a deficiency, and we can probably measure that. And then I got kind of down the rabbit hole of quantified health and biohacking and all of this work, listening to podcasts like Ben Greenfield, and then he would have guests on that were doctors acting slightly outside the system and treating patients with things like chronic fatigue and other very challenging conditions that the medical system pigeonholes as a functional or a psychosomatic or whatever you want to call it. Don't necessarily treat those patients with compassion or are unable to. And I got I'm fairly sensitive and an empathetic person, so I never like to feel like there's some patients that we're letting down. And I saw plenty of those patients through my studies, and then when I started in the hospital as well. So I think my curiosity to different solutions grew as I found the system, and because I went into medicine with a kind of a grounding in biochemistry, with an interest in nutrition and movement and medicine, and not seeing so much of the nutrition and the movement being recommended to people in the system, I figured that there's large gaps that even just lifestyle advice could be given in a lot of cases that can be as simple as making sure that you drink water first thing in the morning. And if you don't do that, generally things don't go that well on that day, but we don't really focus on those small things that can have a massive impact as well.
Yeah, and have you been well received by colleagues throughout this journey as you've been thinking a little bit more broadly and developing your own way of thinking? I'm sure that's different than what the traditional culture is like. I mean, I even have a lot of people here that are very intelligent doctors, but they think I'm a little bit crazy when I talk to them about the basic fundamentals of getting morning sunshine and how important it is not to wear sunglasses, and things like that are very counterintuitive, unfortunately, and even though it's very basic fundamental ways of thinking. So how has it been for you?
I would say in the earlier days it was more challenging, and I would have arguments when I was a medical student with the diabetes teams, who would say that waking up a patient in the middle of the night to check their blood sugar levels is safer than not waking them up. And I would argue that by waking them up, we're guaranteeing them to have abnormal blood sugar levels. To then, I think the world is changing, and I'm optimistic about how health is going, in that I'm a relatively young doctor, and my friends and peers at medical school were aware that I wasn't just a crazy guy at medical school, but also I performed fairly well academically. And I've actually had some doctors come and see me and recommend friends and family to come and see me when perhaps the system isn't able to give them the answer that they want, either for physical pain or a more complex condition. So that has been reassuring and validating in a certain way. And again, a lot of my friends are kind of opening their eyes and minds to these alternative approaches, not necessarily doing them themselves, but they're aware that they're available. And now recently I've joined the London Psychiatry Clinic, which is kind of like a private Harley Street practice here in London that approach me because of my skills, because of my movement-informed breath work that I'm using to investigate whether it can be used for kind of trauma release, and they can be physical traumas or emotional traumas. And then this whole field of metabolic psychiatry, which is emerging mostly from the US, actually. I don't know if you've had Chris Palmer on or anybody in that field who are using, for example, the ketogenic diet to cure things like schizophrenia and bipolar disorder. And there are some very wealthy entities and families who are pushing for this kind of treatment because their friends and families have suffered at the hands of some of these mental health conditions. And so in the world of mental health, people just want help. And I've seen the kind of the worst presentations, and when you're in that position and when you're friends and family of somebody who's struggling like that, you'll do what you can to hopefully help them feel better and get them back on track. So I think at least this is my experiences in the world of psychiatry, is there's a bit more openness to these newer tools, and particularly psychedelics and breathwork, which is kind of our common thread through Amy, has been fundamental in shifting some people's perceptions, because breathwork is free, anybody can do it, and it's a really powerful neuromodulator that's as potent as psilocybin in some cases, according to the data. So I think that's really going to get people asking the question, why is that the case, and how can we use it better, and how can we do it safely? And I want to be at the forefront of this, because when you're a clinician and somebody's sitting in front of you and they're asking for help, then you want a tool that anybody can use anywhere, as opposed to you're dependent on my skills to help you get out of that.
That's amazing. Yeah, I love the approach that you're taking, and I'd love to dive into some of these chains that you have. You have like these 3 chains, and to dive into the nervous system and looking at the body as electric first. And I lucked out throughout my career. I've had 21 years now as a firefighter, and I got to see a lot of mental health suffering as 80%, maybe more of our calls. And then the culture itself, a lot of guys end up having a lot of issues down the road because of the amount of traumatic events and high stress incidents and lack of sleep and all the things. And so I lucked out to discover a lot of this stuff early on, and I was a little bit of the weirdo seeking, before it was mainstream, I think, plant medicines and psychedelics, before finding breathwork a little bit later. But they all were doing wonders for me, and I was lucky to find good mentors and teachers. And but it made me more and more curious about how to bridge the gap between this so-called esoteric realm, something that's looked at as woo, and look for more scientific and medical approaches to like integrating the two. And so I went to a lot of conferences and started to find the people that had been the pioneers in the field, Robert Carhart Harris, I started to read a lot of psychedelic history, and I've had a lot of the people that learn about psychedelics for 20, 30 years on this podcast, and I look forward to having more. But what are some of the fundamental things that you've discovered that are so uniquely powerful for healing that you find you use and want to use throughout your career and throughout your life for your patients that are pretty much not normal yet in our culture, or are at least becoming more normal?
Yeah, so I think the biggest one for me, and the most exciting one, is using movement as a tool to allow people to change behavioral cycles or process traumas. And there are examples of this. Kind of EMDR would be one, so eye movement desensitization therapy, where I don't know if you know much about it, but you essentially stimulate the body bilaterally while you're kind of eliciting some of these things. My mentor, Richard Aceves, who might be a good guest for you as well, he came very much from the fitness industry and was working with clients who mostly had just physical pain or symptoms like their arm would stop working. They wouldn't be able to lift it above their head, like a frozen shoulder, or a loss of neural output to that part of the body. And he began piecing together specific behavioral traits and traumas linked to very specific points of tension or muscle groups, to the point where he's built up a body, and he calls it emotional mapping, where it's like a library of muscles that are linked to specific traumas or behavioral cycles. And knowing this information, you can see potentially where somebody needs to address something in part of their life, but you can see it from a physical perspective. So you can have an objective measure of potentially something that needs to be dealt with psychologically, but you can go at it through the physical body. And I kind of had my own experiences of this. He runs a retreat called Movement Ayahuasca, which there's no ayahuasca involved, there's no psychedelics involved. It's just purely breathing and movement. And he creates like a very personalized workout that kind of breaks down these layers in the body, which is roughly based off the work of Wilhelm Reich, who was a kind of a psychiatrist a long time ago, who was one of Freud's students, who did a lot in terms of de-armoring the physical body to allow people to integrate with society after being very unwell, actually, from a psychiatric perspective. But having this knowledge, you can kind of see what steps somebody needs to go through in order to be able to heal, and you can give them the tools to be able to heal. So rather than needing to outsource to a drug, potentially like a psychedelic, they can have specific movements and sensations that they're searching for in their own body, which will create blood flow and safety in that part of the body. And then it may create an emotional expression or just a change in perspective or perception, which allows them to have less anxiety, less depression, feel generally better about themselves. On the performance side, it can be more confidence, more assertiveness, more motivation, these kind of things. So working with him, seeing some of the changes in some of the people we've been working with and using all of these principles myself, it's that which it's my goal to kind of bring that to the world of psychiatry, but just to bring it to the world in general. Is we don't think of the nervous system as something that we can kind of physically manipulate, but it is what we are doing when we're working with exercise and movement. The body is always learning, like an LLM or any kind of active inference system. I know you had Carl Friston on. By giving it new experiences, it can kind of learn to recontextualize what it has experienced in the past. So it's just that for me, it's like a super intriguing way of looking at the body and then being able to elicit positive changes in somebody's nervous system, which then they experience as a psychological well-being or less physical pain. And that would be number one.
Yeah, that's amazing. I'd love to go a little bit deeper and hear a little bit about, I've heard you speak to this lactate metabolism and some of your research on that. But I also wanted to hear your perspective on labels like ADHD and, anxiety. And you see a lot of people, I'm sure, that come to you that have these labels and have been prescribed different medicines or given different even relational like concepts about what this means. And just something that I'd like to share is that I've seen people that have been labeled ADHD as some of the most brilliant and amazing people, and they just were in the wrong environment. And I think one of the biggest issues we have with the centralized medical model is that we look at the idea of trying to fit this person into a sort of sick society, and we're measuring them up against something that seems a bit like Krishnamurti would say, it's no measure of health to be well adapted to an insane society. And I somewhat started to see that perspective years ago and realize, yeah, that's probably the issue. Like if you see someone that needs movement and action and sunlight and all the things, doesn't mean that they're broken because they can't sit still in a 90 degree chair for the day. So can you just speak a little bit to some of this issue?
Yes, I think it's a super topical conversation, particularly at the moment. And I think for whatever reason, we are seeing increased rates of these diagnoses. And I think potentially it's an adaptation to our modern environment that's occurring. But I would agree. I mean, I would potentially put myself in that category of having some of these neurodivergent traits that we would define maybe more recently as ADHD, which is kind of this autism ADHD combination. And I would be seeing a lot of patients and colleagues who would be similar in that they have this, in some cases, elevated IQ, but have never been able to almost make sense of the world around them. But it's not necessarily their fault. It's the environment that they've been brought into. And as you say, kind of the schooling system as it is, being told that you need to sit down. But again, I managed to get through it and do pretty well academically. But now I generally need to move my body. Otherwise, like sitting down all day, day in, day out, just does not allow me to function as well as I'd like to. And most of my superpowers personally are in my brain. And if my brain doesn't work properly, then what's the point of me having those superpowers in the first place? There are these neurodivergent systems are more sensitive to trauma, I would say. So it becomes very difficult if somebody has like a very early life trauma or a combination of lots of early life traumas. It can add up, and their picture can look very much like the same types of traits, and they may be secondary to the traumas. They may be amplified because they had this neurodivergent trait before, and then the traumas added up onto this. And I think in some cases, the labels can be very helpful for an understanding oneself. And I think, again, meditation basically means to understand yourself or to understand your own mind. And I think in that case, where labels are used as a way to understand the things that you need to do for yourself in order to function at your best, great. The solutions for on the severe side of this, maybe medication, maybe whatever treatments are available. We have newer ones that are quite cool that I've been playing with in the field of neuromodulation, that maybe we can touch on as well, that allow us to kind of begin to understand a bit better where we fit in the world. And if you have a kind of stable period of not more stress coming in and this understanding of how you fit in the world, you can then begin to create the environment around you that supports you and not necessarily represses you or makes you feel like everything is stressful and it becomes unmanageable. And I think a lot of people who are stuck with this, they aren't aware of that. And until you come out of that environment and you go maybe to somewhere that's lovely and sunny and you live on the beach for a couple of days and then you realize, oh, my symptoms are much better, or I'm feeling much more free, much more creative. That part of your brain that was stuck in kind of like a survival mode can start to relax, and then you have these kind of creative ideas coming through. I think that's a pretty good indicator that maybe you need to change something in your environment. And on the other hand, there are cases where people use labels as a way to excuse them from doing anything proactively about their health. And generally, they're not the people I like to work with, because I think health is all of our responsibility for ourselves. And if you can't put yourself first, then you shouldn't even necessarily be looking after anybody else too. So I think there's a big element of self-compassion that kind of comes through, and being able to give yourself compassion requires you to understand yourself. So there's a benefit certainly to the labeling, but to be used for good rather than evil, I suppose.
Yeah, and I'm sure it's really hard to get people that have already started taking antidepressants and anti-anxiety meds and ADHD meds at an early age. I've had friends that, got hooked on these meds in their early teenage years. And then as they hit their 20s and late 20s, if they start to try to wean off or stop that medicine, their neurochemistry and biophysiology just is so radically affected that it's not an easy process. And so it's just a very complex story, but it's so quick now in our culture where people are just going to label you so that you fit a category in the DSM, and then you quickly administer a certain box and a certain med for that problem without fixing any of the environmental factors like you're talking about. And I'm seeing that shift start to happen, where I think because of COVID during 2020, I think that was a really radical shift in people's perspective, maybe almost the pendulum swing too far the other way, but people started to distrust and realize that the system has been broken and incentivized, and we've been somewhat bought into a narrative that's not quite true, and that we should question authority, and maybe we shouldn't just trust our doctor because, they went to school for however many years. And so I think it's actually a healthy sign that people are at least starting to take more responsibility and to do their own self-empowerment and research. And a lot of people are starting to return to nature. And I'm curious about your thoughts on light and how much that plays a role in your thinking, because I know that we talked about Dr. Jack Kruse before we got on here, and he's played a little bit of a role in your thinking. So how much of a role do you think light plays when it comes to darkness and morning light and daylight and indoor blue light and all of these features?
Yeah, it's a long time since I've been digging into the light data, just because I've had other things more prominent. But I went through a good couple of months, years looking into Jack's work and the light data. I mean, there's more coming out suggesting that the circadian rhythms and our light dark cycle has one of the more profound impacts on our mental health, let alone our overall health. It's linked to blue light at night, for example, is linked to a number of cancers, and probably all cancers, and the likelihood of them spreading after you have them. Paying attention to these signals that if you don't, you said at the start, they're not necessarily intuitive, but if you really start to pay attention to them, they should be intuitive, because again, somebody asks you, how long should you spend outside during the day? I say, go and ask the sheep or the cow in the field, and they will tell you the answer. Generally, we should be out as much as we possibly can, to be honest. And it's probably our lack of being outside that makes us fearful of being outside when we do go outside. And actually, the data that Jack always likes to bring up, that vitamin D levels are protective of cancers, even skin cancers, and indoor working is a risk factor for developing melanoma, which is a paradox. But it's likely the same with kind of binge sunning when we haven't had sun all year round. And on the kind of scientific side, Dr. Ted in health optimization medicine would suggest vitamin D, the receptor itself, has been around essentially since single organisms were around. And therefore, the fact that something has been so consistently in our biology means it's very important. And therefore, we should pay attention to vitamin D itself, but also how evolutionarily we would create vitamin D, which is getting sunlight on our skin. And our body and our skin and our eyes are all paying attention to the signals that come through in the spectrum of light that is in the sun. So just using a sad lamp and then spending the rest of your day indoors is probably not going to be as beneficial as taking even 2 minutes, but ideally more in the morning to get that blast of sunlight that, even if there's clouds, which we get a lot of in the UK, that signal is still making it through the clouds and it's still benefiting our brains. And the hormones and the neurotransmitters and all the chemicals that come downstream of the light signal coming in are the ones that wake us up in the day and tell us when we should go to sleep 10, 14 hours later after that. So a lot of people kind of get into the very nitty gritty of their sleep routine in order to improve their sleep, but it can be that they're not doing the things that they need to be doing in the morning and during the day, which is the reason that they can't sleep at night. I think we're probably only beginning to scratch the surface on how important light is for our health in terms of at the conventional level. I think there's maybe a bit more openness to that concept too. Again, you only have to start reading the studies that really tell you how important it is. I just think, again, conventionally, we were never taught about light in medical school, really, although we used it to treat certain conditions in young children, but we don't really consider why that might be important. So yeah, it's a fascinating topic. In health optimization medicine and practice, we have a module that's chronobiology, so it kind of goes into all of these factors that influence the cycles in our life. And those cycles are not just daily, but they're seasonal and yearly and monthly. And again, having worked with people from like a behavioral trauma perspective, sometimes, again, a month might be particularly difficult for somebody and they don't realize why. And then they kind of look back, oh, that was the month that their one of their parents passed away like 3-5 years ago, and again, it was a learned response that, again, they didn't know why they were feeling low in that month, but it's something that they can then kind of begin to come to grips with, and paying attention to these signals. And on that topic, I think we generally feel lower in the winter and more happy in the summer. And I think we are very quick to judge ourselves. But I think biology there's a deliberate feature. It's not necessarily a bug in the system, but I think we should be potentially more introspective in the winter, because it's time to kind of conserve energy and plan for the year ahead. And then when the resources are available in the summer, there's more food, there's more energy available, there's more light. We can go and do all of the things that we want to do to move our life forward for that year, and then conserve again. And being aware of these cycles is super important. But yes, I'm generally a big proponent of getting people outdoors in the morning, and making sure that they monitor their lighting solutions towards the evening and nighttime, and ideally not impacting their sleep with artificial light at night and artificial inputs. Like, I think probably the scrolling and the news and the interactions that happen on social media now are probably worse than the actual light from your phone for stimulating your nervous system, and maybe even the flicker as well. I've been somewhat involved in the Daylight Computer company as well. I don't know if you've had any of those guys on, but I really like it as a way that technology is going kind of clean and more nature-based into the future, particularly focusing now on children, which is really where the change is going to have to happen, because adults like to become more stubborn. And
Yeah.
it's difficult. It is difficult to change when these things are so dramatically at odds to the way that we were brought up and the way that we thought about what's important.
Yeah. Yeah, the Daylight guys are awesome. That's great technology. I'd love to get them on. I just haven't had the opportunity yet. And I'd love to talk a little bit about how you share breath work with people and what that even means and why it's so important. Because for me, I found that, I don't know, in 2011 when I started diving into that, and it was probably the biggest game changer for me, that I started to go to workshops and trainings and books and went deep down the rabbit hole. And I never found a bigger bang for my buck return on just overall health and well-being, and learning how to breathe nasally, and just completely thinking about the breath as the fuel source and the nervous system regulator. And I've even done the Swami technique that I think you're going to speak to a little bit. And so anyway, I just love to hear that, because I feel like the light story and the breath story are just so free and effective. And so I'm almost evangelical about both, because they're so simple for people to get so much return, that 80% in like a short period of time. And then they can chase that last 20% later. But it's like, let's get everybody's head above water. And I feel like the light and the breath thing are the foundation. So let's hear a little bit about your approach to breath and what you've discovered and all that.
Yeah, I think formally I was introduced to breathwork via, I must have come across Wim Hof when I was at medical school. And I actually remember doing Wim Hof breathing while I was driving into clinical placements, which I don't recommend, because I was doing fairly long breath holds while I was driving, which obviously is stupid, but I don't know why I thought that was a smart idea. So don't do that, anybody. But yeah, there was something that I learned, that the kind of like ability to relax your system at will, essentially, and to have, in some cases, like a cathartic release, doing it in bigger groups, and kind of not necessarily myself, but seeing other people like break down into tears and being curious about that. And then fast forward to working with Richard in the movement world and using breath as a tool to cultivate awareness. And so our inhale generally allows us to be more aware of what's going on in our body, and our exhale generally allows us to relax and activate more of the parasympathetic nervous system. So Richard developed this technique where we use the inhale to dictate the range of motion of our breath, and the exhale to allow everything to relax. So it's a contraction and relaxation cycle with breathing. And so if you consider When we breathe, we are breathing into our lungs, but actually it's a whole body that's breathing. Everything is expanding and everything is contracting, because the goal is that we deliver oxygen to every single cell in our body, and then we use the oxygen, and then we get rid of carbon dioxide from every single cell in our body. And that happens through the lungs, and then the bloodstream happens very quickly and then kind of reverses itself. And so if you can imagine that if, for whatever reason, let's say you sprained your ankle a couple of times playing football in the past, that part of the body becomes almost stagnant and is a bit maybe scar tissue, or just a bit more resistant to the contraction and the expansion phases, and it almost is protecting itself. There's a potential problem there if you're not able to deliver oxygen in order to heal that part of the body and get rid of the waste products in the carbon dioxide. Through physical training, we found that athletes, depending on how good of an athlete they were, which is not necessarily what they think, but what we think is how well they were able to breathe into certain parts of their body, and how well they were able to connect to the larger structural muscles of the body, i.e. the chest, the lats, the glutes, the hamstrings, the quads, with that inhale, and how much awareness they would have of that contraction gave us a very good idea of how good their breathing mechanics were under stress. And so by challenging those breathing mechanics under stress and watching and assessing people, the way that they breathe into different parts of the body, we have a very good objective tool for seeing how well somebody's able to breathe, but that tells us about how their nervous system is able to handle stress. So it kind of goes full circle to what we were talking about at the start. And having worked with Amy and Guy at the university, so Guy Fincham has published some large meta-analyses in breathwork. He's Mr. Breathwork. If it's been written on breathwork, he'll have read it. He's just about to be in a documentary that's coming out that was filmed with Amy at the university, kind of talking about the research that we've been doing. The breath is a very powerful neuromodulatory tool. So we're doing things in the brain, but we're also getting the body to a safer place as well through activation of these very structural muscles to allow the nervous system to oscillate in a way that it can contract and expand as a unit in its entirety. So that's where my interest and where I've been kind of showing Guy something new, in that it's not just the diaphragm and the ribs and the traps maybe that are important for breathing, but it's every single muscle in the body. And if you find your weak spots, or the spots where you're a bit more deficient in strength or connection, then by working those, you can build resilience in the whole system. And again, it's a tool that's free. Essentially, the Swami technique, which you mentioned, you lay down on the floor and you put your fingers just inside your hip bones where your psoas muscles would be, and you can look those up and find a picture of them. And inhale and contract, and almost think about pushing your fingers outwards. And then when you exhale and relax and your fingers go in, just by gently starting there, you'll start to feel your body begin to work as a unit. And rather than breathing in your chest, maybe more of a stress type pattern of breathing, you can start to engage the diaphragm, but the diaphragm with the pelvic floor. And again, the body can start to work as a unit that is not in a stressed state, because a lot of these muscles begin to shut down. For example, if you sit in a chair for a long period of time, the psoas muscles get very short and tight, which means then they're feeding up into the diaphragm, which then gets short and tight as well. And then the breathing becomes restricted. And then people talk about having bad posture because they're sitting all day. It may not necessarily because their shoulders are hunched over. It may be because the psoas is becoming so tight that the shoulders have to hunch over in order to kind of protect the breathing mechanics to the best of its ability. And it's these areas of increased tension, which I think we will come to see in a few years' time, which are potentially more at risk of any type of pathology. So in athletes where people have a lot of tension, they generally cause issues. So maybe they tear their Achilles, or they have an ACL rupture, or a muscle strain or pull. But the thing that I pay attention to is these movement patterns and the way somebody breathes, potentially that leaves them open to maybe problems with their gallbladder or problems with their stomach, because they hold all of the tension in the muscles around, and that area of the body is not able to contract and expand, which then it's not able to get enough oxygen in and get rid of enough of the waste products. And then over time that accumulates and accumulates and accumulates, and then the cells get very stressed, and then manifestation of symptoms after that. I don't have any data on that, but it's just my intuition that I think being able to breathe into different parts of our body is a good signal that we're healthy in that part of the body.
Yeah, I love that. All good stuff. And I'm curious your perspective on fascia. And now there's a lot of really incredible people that are diving deeper and deeper into this system of fascia and how much that plays a role and how complex and interesting that subject is compared to just 10 years ago and everywhere before that, how we looked at everything as just muscles and bone and ligaments and tendons. This fascia story seems to be pretty eye-opening too. And a lot of people study it from top down and then bottom up. And anyway, I've been messing around with it a little bit myself. And a lot of it has to do with breath in combination with just feeling the fascia and using your own personal manipulation and massage techniques on the feet and going upward and things like that. But what do you think about fascia?
Yeah, I think it is a very important sensory system. And I think the environment is interacting with us through our fascia in some way. And I don't think there's good data on that. But I almost see the muscles as the action system and the fascia as the sensory system. And if the sensory system is telling the muscles there's a threat, they'll begin to shut down or activate in certain areas of the body and not others. And so a good example of people that pay attention to this would be the human garage, who are getting quite popular at the moment. My concern with the fascia is that some people go purely down the route of fascia and it becomes all about doing releases and releases and releases and releasing, but never doing the work on the other side to change the movement pattern. And so just because we come from the fitness industry, I suppose, if you're an athlete that squats 200 kilos and you think that a little massage and a fascia release is going to allow you to then go back to squatting 200 kilos without back pain, it probably isn't, just because the forces that you're placing on yourself, you can't really recreate with just a manual release. But I think there is certainly power in the fascia. The videos I've seen come out of the human garage with some of the emotional releases that people have and the tools they have at their disposal, where they almost have like 5-10 people working on one person at the same time. I think there is potentially a potency in that to reprogram or at least gain perspective on events from the past purely through looking at the fascia. And I published this paper that kind of talks about these two torque chains. So this internal torque chain, which is the structural muscles that I've talked about, so the lower part of the pec and the upper lats and the obliques and the psoas and the inside quads, hamstring, and the lower part of the glutes, working against but with the external torque chain. And I think the fascia probably is intertwined more so with that external torque chain, which is almost the antennas for stress. And so I think a good thing to do is practically to take care of your fascia. And the way that you can do that is making sure that you're hydrated, which doesn't just mean drinking water, but making sure you have minerals and all of the relevant water-soluble vitamins on board to produce water inside of ourselves. Exposing yourself to good light, because we know that cortisol and the response in the morning influences collagen fibers, for example, and collagen makes up a large proponent of that fascia. And keeping levels of inflammation low, because if we have inflammation, there's almost like a stagnation and the body becomes very restricted, and it will only start to move when the inflammation levels are low. So that can take many forms. Getting good air in and breathing is a good way to reduce inflammation quite quickly. But then there's other kind of metabolic features and nutritional factors that we can kind of incorporate, and they can be generic or they can be measured with organic acids testing or metabolic testing that give us a more precise route in order to kind of deal with your imbalances and your deficiencies that might be influencing your fascia, for example. And that's the perspective that I got from Dr. Ted in Health Optimization Medicine, is if you break everything down all the way to the level of a single cell, imagine the whole body is just an accumulation of cells, and that as a health optimization medicine practitioner, we're focused on the health of a single cell. Then you can simplify these inputs of contraction and relaxation, the health of the membrane around the cell, the health of the mitochondria, the health of all of these organelles in the cell, the health of the cytosol, which is the water and the gel matrix and the structuring that happens, the influence of energy and light on that cell. And then knowing through the work of Robert Navio that the cell, through evolution, only responds in one of 8 ways in response to stress. And therefore, when you understand those ways of responding to stress, they're likely to be the ways that we respond under stress. And by paying attention to that, which is called the cell danger response, we can then optimize the response of that cell to the cell danger response and make sure that it resolves itself. And that's essentially what we do, is trying to resolve that cell danger response so that the body has enough energy and resources and oxygen in order to heal from whatever it's gone through in the past. And only once you get to the state of having enough energy, and then you can enter that parasympathetic system, then the healing can begin to take place. I think there's a lot of people that try and force their healing process. But generally, if you're stressed, you are going to spend much less time in that parasympathetic system, and therefore all of the resources are going to be kind of directed outwardly, which can be the immune system fighting. Immune system can fight inwards as well if you take yourself down that path as well. And so it's being able to be present with yourself. And again, there's a lot of people I come across that find it very difficult to be present with themselves and their thoughts. And they tend to be the ones that are very into longevity. But if you can't relax with yourself, then the capacity to heal from stresses and traumas and whatever is going to be fairly impaired, because there is a time for us to have to regenerate and recover. And I don't think just doing it when you're asleep is possible. I think that needs to kind of bleed into the rest of your day as well.
Yeah, I find that to be pretty common with friends and people I know, and just seeing it in our culture where everything now is about going to the next optimization center or the next workshop or the next event and the next therapist. And you're driving in rush hour after you've been working all day, and you're doing all this extra stuff to try to biohack or whatever it is. And it's actually funny that the thing that probably would be most beneficial is to just slow down and let go, and maybe just do a little walk with a little mindfulness of the breath, or lay down on the floor and, or go to the park and watch the sunset. That might have been far more beneficial to the nervous system and to the mind, and which would allow the body to intuitively heal itself. And a lot of the dis-ease is caused by the constant, fight or flight. And it's really hard to get people in our culture to get into that parasympathetic. And it's just uncommon, because I think a lot of times people feel it's almost a cultural indoctrination of, I should be doing more. I need to be doing something for myself and my body. Yet the most powerful thing you can do sometimes is to stop and to slow down and to let go. And in my little breathing groups, that's 90% of what we're doing, is slowing down, letting go. And it's really hard for people. And so sometimes that's the most difficult piece, is that just slowing down. And I've just noticed that is the medicine for at least the Western culture. And I'd love to hear some of your perspective on what your work is dealing with lactate metabolism, and what you've discovered with that, and just what that even means for the average person listening.
Yeah, it kind of comes back to the imbalance and deficiencies model that I was saying. Generally, if a lot of your time is go, go, go and very fast, then on the other side of that is the slow stuff. And it can be very difficult for people to slow down. And then there's tools that can be useful to enable people to do that. So I'll mention it just because it's in my head at the moment. We're using TMS, or specific device here called ExoMind, which I really like, because in order to have the treatment, you have to lie down flat and you're not allowed to have your mobile phone in your hand. And it treats you for 25 minutes. And you have to kind of stay awake. Ideally, you don't fall asleep. But it seems to really, for those people that are very go, 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 it seems to give them at least 25 minutes of downtime. But afterwards, they feel very clear and less noisy in their head. And it's something that I'm getting into more recently. So maybe if I ever come back on, I can tell you about some results with that. But it seems to be very promising so far for the people that find it very difficult to slow down. And the other thing would be paying attention to things that raise GABA. So we have the on switch for our brain, which is glutamate, and then the off switch, which is GABA. One thing people can do is make sure they're taking methylated B vitamins, because one of those, vitamin B6, is important for the conversion of glutamate to GABA. So it can help address that balance between the on and the off switch and allowing people to wind down. There's a company called Troscriptions that I'm related to in the US that make a TroCalm product that contains a form of GABA that can cross the blood-brain barrier, which can be amazing for some people that struggle with anxiousness and not being able to slow down. And then kind of coming into lactate. So I got very interested in lactate through my interest in movement. There were studies in the 40s, 50s, 60s that showed that when you did exercise testing, so classically in sports and exercise medicine, they'll put an athlete on a bike and they'll gradually make it harder and harder and harder, and they'll track their lactate over time. And at some point, lactate loses this steady state relationship and dramatically rises. And very elite athletes can stay at very low levels for a long time, and then they can produce massive amounts and maintain that for a long time as well. And it's madness. But they showed that people with a form of anxiety, a form of, I can't remember the term that they used to describe it back then, would have these much higher resting levels of lactate and produce much more in a short period of time, just doing cycling on a bike, that was comparable to people with cardiovascular disease.
Wow.
And so it was that response of the body of producing a lot of energy very quickly that got me very interested in lactate as a thing. And I say energy because people think lactate is this waste product that makes our muscles burn, but it's actually a fuel that our body produces. So we have slow twitch and fast twitch muscle fibers. And the fast twitch muscle fibers, like the ones you would do to lift a heavy weight, for example, they produce lactate much more quickly, and they can actually pass the lactate to slow twitch muscle fibers. So when you go for a run, for example, your fast twitch muscle fibers can produce lactate and pass them to the slow switch, which allows you to run for a long period of time. If you're a very good athlete, you can produce the lactate efficiently and you can use it efficiently. When lactate gets locally high enough in concentration, it will then go into the bloodstream. And then as the stress increases and increases and increases, that lactate in the blood will go around. It will start to fuel the heart and will start to fuel the brain, or at least it will go into the brain. There's a lot of controversy about whether it's actually fueling the brain. I think it probably is to an extent, because at least in children, lactate is one of the primary fuel sources for the neurons in the brain. And it can be protective in traumatic brain injury for adults as well. And so if you kind of think of this conceptually, the poorer the quality of the mitochondria in your body, the more likely that lactate is going to end up in your brain, because there's no sink for it. And so if a stressful event happens, it's going to create a wave of lactate that may more likely go into your brain, which can trigger panic, heightened arousal, memory formation. So if you can see that happening in a passive situation, so something very stressful happening in somebody's life that's a negative event, a lot of lactate gets produced, heart rate goes up, lactate ends up in the brain, and it encodes a new memory. And that memory basically says this is an adaptation that we need to have in order to be prepared for this type of stress to happen. And I think evolutionarily this came from the classical saber-toothed tiger comes out of the bushes, and you get this wave of lactate that comes up but we use that in order to make sure that we don't build our tribe near where the saber-toothed tiger lives. Or we use that fuel to run away from the saber-toothed tiger and escape, which is the flight mechanism. So my work over the last 3 years, I was looking to see whether I can measure lactate in a specific area of the brain called the anterior cingulate cortex, and whether, like in the exercise testing where you can measure it in the blood go up over time, can I do a task with somebody in an MRI scanner, expose them to an increasing demand and see the lactate go up and then come back down? And then could I eventually use that in a group of patients and see differences? Maybe they produce lactate more quickly in that part of the brain, or they produce it more slowly and it's more delayed as a response, or they produce it in the normal rate but it stays there for longer and takes longer to get rid of. And I think those parameters are very important, particularly with this realm of metabolic psychiatry, where we see that the mitochondria, the ability to use lactate as they become more dysfunctional, there's a potential behavioral response to that in the physiology that happens. And so that was my PhD, which is still in kind of preparation for submission, but I have a preprint out and it's submitted to a journal in terms of the actual approach. So I was able to kind of watch lactate go up and then come back down in response to a task that gets faster and faster. And it's just a cognitive task. So there's no exercise or anything that's happening in the body, which was super cool, because I thought it would be the case, but to actually see it was really exciting. The next kind of step is to be able to do that on a N=1 basis. So you could expose somebody to a specific type of stress that might be more stressful for them, and then be able to see what their brain's response is to that, and then hopefully find ways to modulate that response over time so that they're less stressed by whatever that thing is. But I always have this framework in the back of my head when I'm working with somebody from a movement perspective, is what type of movement do they need? Do they need more longer, steady zone 2 type training to build their capacity to handle lactate? Or do they need more very intense exercise to be able to produce more lactate in order to get them going, more motivation? And then finding that sweet spot of how many days of the intensity, how many days of the slower pace stuff, and then combining that with the targeted muscular work in order to get the whole nervous system working as a unit. So yeah, that's the lactate story in short.
Yeah, and I haven't really heard anybody else speak to it the way that you do. So I'm excited to see what you keep discovering and how people can use their body and their mind and their breath and all of these things to modulate, I guess you could say, lactate in a more efficient manner to have the best outcome. What are some of the most bang for your buck practices and ways that if you everybody's so complex and different and everyone's environment's different and we're so unique, but what are some of the biggest bang for your buck returns that you think people could do to start with to be feeling better, to minimize suffering, to have a little bit healthier outcome in their daily lives?
Yeah, I think one of them is, I call them, this came from an old mentor as well, as Disney walks or active meditation. So you listen to Disney music or music that's more instrumental with very kind of like nice, nostalgic voices almost that are high pitched. And this puts the brain in kind of like a safety mode, which is the work of Stephen Porges and the Safe and Sound Protocol. And you walk somewhere that's fairly familiar, nasal breathing fairly briskly, and you don't let your heart rate get over 140 beats per minute. You don't have to be too strict about this, but essentially just going for a nasal breathing walk for 20 to 60 minutes. You can go longer as well, ideally in nature. Ideally first thing in the morning when the sun's coming up. Out of all of the practices, I would say that's the one that allows people to feel a lot more grounded, allow their brain to relax, allow them to process their thoughts and get through a lot of that background chatter, and get their body moving in a bit of blood flow, but nothing too intense. That builds energy as opposed to removes energy. So rather than feeling kind of depleted after exercise, in inverted commas, that nasal breathing walk just kind of keeps you at a sub lactate threshold, essentially, that allows your mitochondria to start building, we call mitochondrial biogenesis, but also with the music and the breathing allows you to kind of enter this almost trance-like, almost theta type brainwave pattern, which when you get good at this, you can start going on these walks and you'll have creative ideas pop into your head quite quickly, just through not thinking about anything in particular and letting your brain relax. I would say that would be one. So, and just going for the walk in the morning without any of that detail is probably just as good if you're like need an excuse to not do it. Don't make it too complex. Just go for the walk.
Yeah.
That would be number one. Number two is on the other side. I think there's a lot of fear around physical intensity. And I don't necessarily say this as something to do every single week, but one session, if people can manage it safely, depending on their own personal context, is some level of extreme physical intensity. So I don't know if you've ever tried an assault bike or know what I'm talking about. Yeah.
Yeah.
Is choose a number of calories and sit on the assault bike and try and finish it in as fast as possible and go as hard and fast as you can. The goal is just to murder yourself on the assault bike as quickly as possible. You can kind of ramp up and do a few warm-ups, but the goal is to basically produce as much intensity in your body as possible and have this overwhelming physical sense of stress, but you're going into the stress yourself. And then afterwards you can lay on the floor and go for a little nap or do whatever you need to do. But that exposing yourself to the extreme stress that's under your control, I think also has an extremely beneficial effect. Not only is it producing a large amount of lactate and you get better at producing it, but you can also deal with that stress better and your system gets used to experiencing it. We kind of call it distress tolerance. And I think for a lot of people, the ice bath is almost in that realm, but it can be a bit of a blunt tool, and it's quite dependent on certain biological features like your fatty acid intake, and for some people it's not ideal. But I think that the limitation with the assault bike is you can only push as hard as you can physically push. So it's titrated to your own ability. There's more specific ways to get at that through having a good coach, but also you can use the sleds. So like the prowlers, if you have a car park or a parking lot or whatever you guys call it over there, like a 200-meter stretch and just pushing that as fast as you can for 200 meters. Again, you'll get cramping in your legs probably, and you'll need to lie down for a bit afterwards. It sounds miserable, but afterwards you'll feel super energized, and the next day you'll have this kind of new wave of motivation to do certain things. In most cases, I found. They would be on the movement side. What would my last one be? I think with health, I would argue that health is measurable now. So there's a lot of people who take a lot of supplements and they follow what their friends tell them and they do X, Y, Z, and they spend a lot of money. You can get a reasonable quality organic acids test, gut microbiome test, food intolerance test. If you have those, and you can find a practitioner or you know how to read the results yourself, I would do that, because you can save yourself a lot of money and you can specifically target your own deficiencies in terms of vitamins, minerals, cofactors. Some of them influence the neurotransmitter systems, whether you need probiotics, prebiotics, whether you need support with your digestion, digestive enzymes, more fiber in your diet, more specific fatty acids. We didn't really get into that, but I'm a big proponent of checking your omega-3 ratios and understanding the balance of omega-3s and omega-6s. Obviously, your vitamin D levels are a pretty good marker of how good your environment is and whether you're able to get outside enough. And I'm more on the side of, if it's deficient, you should supplement with it, as opposed to some others maybe in that realm. But I think it depends kind of what capacity your client base or patient has to make a change there and then. I would rather somebody get sufficient levels of vitamin D to protect themselves. Immune system XYZ, we know it's very protective in certain conditions, in fact, most conditions. If you're vitamin D deficient, you're more likely to have more symptoms and more suffering. So yeah, I think I would say measure your health and correct any imbalances and deficiencies and subtle toxicities. And a big one that maybe you're not paying attention to is light and exposure to even to Wi-Fi and Bluetooth and all of these tech devices, even if it's just to get away from the news and the rubbish that you can expose yourself to very easily on these devices very quickly.
Yeah. Thanks for sharing that. Yeah, I love the intense workouts. Once in a while, we use the assault bike at work, or we have the row machine. That thing can do it too, where you just basically deplete yourself. A lot of times we wear our turnout gear and do these little 20-minute skills courses too, and those just are so difficult. But when you're done, you feel incredible. So I'm the same way. I think it's really important to do really hard things sometimes for the body, and it just wakes up the animal, you know?
Yeah.
I know you got to get going. I just wanted to ask you real quick about psychedelics and your thoughts on them and your own personal journey with them, if you've had it.
My thoughts are that they are very powerful tools and that they should be used with care. And I think care is the important feature that, as I say to or discuss with my friend Guy as well, it's the intention that comes way before you even use the substance, and then the set and the setting of when you're going to use it, where, how, why. That is probably 80% of what's going to happen. And then the actual dosing and the experience is very dependent on who's using it with you, and the support during, and then also knowing that there's a safe place to go afterwards and having the support there for the next, I don't know, even 6 months, depending on the level of intensity of the experience. And I say that through personal experience of having a pretty intense and more on the negative side experience twice, and I've had a positive experience with another psychedelic, all done in places where it's legal to do these things. And I think they're certainly tools that we need in psychiatry and in mental health and in general population health, and they need to be used in a way that is regulated by people who really care. And I think that people should take care and do their due diligence on the people that they want to support them going through these experiences. But I do think that they're valuable tools for that reason, because they build very good relationships as well between you and a therapist. And that's one of the most important things for the success of a therapy. I'm not such a big fan of using them without therapy, which seems to be, well, it was initially a thought by pharmaceutical companies to just offer the psychedelic, but without any talking therapy or any form of therapy afterwards. I think if you're going to use something that's giving you a period of neuroplasticity, then it's probably useful to fill that period with positivity and beneficial coping strategies and changes. So yeah, I could go on a long story about my experiences, but I will save it, I think.
Yeah. Well, I thank you for sharing that. Maybe next time we have you on, we'll talk about some of the other stuff. I'm excited to talk to you again in the future. But if you were going to die today and this was the last day on Earth for you, what would you want to share with the world?
I would share that I believe that you should always have hope, that my learning is that I keep finding teachers who have a different way of approaching potentially the same problem, and that if you think that you've done everything and you're finding yourself in a place where you think that nothing can help, there is somewhere, somebody, something that will be able to help, and that keep hope for a bit longer and it will show its face or head in a way that you weren't expecting.
Beautiful. That's a powerful message and a much needed message. So I appreciate that. And I appreciate your time today. It was really fun chatting with you.
Yeah, it's been great. Thanks so much. I've enjoyed it, and I'm it's nice to meet you, and hopefully I can connect you with a couple of cool people to have on as well.
Yeah, I would look forward to that. There was a lot of nuggets in this conversation, and I'll be sure to refer everybody to your work and put all that in the show notes, and we'll do that through email at the end. But appreciate
Great.
your time.
Awesome. Thanks so much, Ryan.
Yeah, thank you. Thank you for listening to the episode. If you enjoyed it, please share it and subscribe to the show and rate the show. That helps people to discover it. And enjoy the next episode.
What we call reality is in fact nothing more than a culturally sanctioned and linguistically reinforced hallucination of some sort.